right, welcome everyone. Today, we're diving into a topic that's central to understanding our patients and how they change over time, lifespan and development. Now, as EMTs, we interact with people of all ages, newborns, teens, adults, and our senior population. Each age group comes with its own unique needs, challenges, and considerations when it comes to care. This chapter is all about understanding those differences so we can provide the right care for the right patient at the right time. We'll look at how humans grow and develop across different stages of life, what's normal, what to watch out for, and how development impacts both their health and our treatment decisions. From that first breath to the golden years, every stage is packed with details that can help you make better assessments and interventions in the field. So, while we're working through this, think about your own family, friends, or even your own experiences at different ages. It's not just about remembering facts, it's about connecting those facts to real people. Sound good? All right, let's get started. All right, let's take a look at what this section is all about. We're focusing on a key area of the EMS curriculum, lifespan development. This is all about understanding how people grow and change throughout their lives, and how those changes affect their health and medical needs. We're not just looking at textbook info here. This knowledge directly applies to how you assess and manage patients. What's normal for a newborn might be a red flag for an adult, right? Knowing what to expect at each stage of life helps you make better decisions during patient care. All of these areas tie into the National EMS Education Standards. That's our blueprint for making sure you're ready for anything the job throws your way. So, as we move through these slides, keep in mind how this knowledge fits into real-world scenarios. Let's break it all down step by step. Let's start with a simple but important truth. Humans are always developing from the moment we're born until the moment we leave this world. As EMTs, it's critical for us to understand how people change physically throughout their lives. Why? Because these changes aren't just interesting. They directly impact how we assess and care for our patients. For example, how you approach a newborn is obviously different from how you'd handle a teenager or a senior citizen. Each stage of life brings unique challenges and considerations, and knowing what's normal for that stage can guide your decisions in the field. Over the next few slides, we're going to explore the key stages of life and what you, as an EMT, need to know about them. Think about how this knowledge might change how you treat different patients and how it could even save lives. This lecture is pretty short but packed with information, so don't be afraid to listen to it more than once to make sure you get a good grasp of how people change characteristically as well as physiologically. All right, let's break down the first stage of life, neonates and infants. This stage, from birth to 1 year, is all about rapid development both physically and emotionally. Neonates are babies from birth to 1 month, while infants cover 1 month to 1 year. At birth, neonates typically weigh between 6 and 8 pounds, and here's a fun fact. Their heads make up about 25% of their total body weight. These little ones grow fast, gaining about an ounce a day, and by their first birthday, their weight can triple. Pretty incredible, right? Now let's talk about the cardiovascular and pulmonary systems. At birth, there's a huge shift as a baby transitions from fetal circulation to independent circulation. This means their heart and lungs take over the job of oxygenating blood, which is a big step for such tiny bodies. Their vitals start high, a pulse of 100 to 150 beats per minute, and a respiratory rate of 25 to 50 breaths per minute. With a pulse that should be this high, understand that there comes a point that we'll discuss later where their pulse is too low to keep them alive, even though they may still have it. Another critical part of this transition involves a small hole in the heart that connects the two atria sealing up. If this doesn't close properly, it can lead to issues we'll dive into later, but it's something to keep in the back of your mind. Infants under 6 months are especially prone to nasal congestion, which can cause respiratory challenges. Combine that with their larger tongues and shorter airways, and they're at a much higher risk for airway obstruction. This is something you have to be hyper aware of when managing their breathing or performing interventions like bag mask ventilation. Their lungs are delicate, so when providing care, especially with ventilation, gentle techniques are key to avoiding further complications. These first 12 months are all about major changes and rapid growth, and understanding how their tiny bodies work will help you approach these patients with care and confidence. Treating infants means being precise, gentle, and always paying close attention to the unique challenges of this stage of life. Now let's move to the nervous system. At birth, infants come equipped with reflexes like the Moro reflex, where they open their arms and spread their fingers if startled, and the rooting reflex, which helps them find food. As they grow, we see exciting milestones. By 2 months, they're tracking objects and recognizing faces. At 6 months, they can sit up and start babbling, and by 12 months, they're often walking with minimal help. Another key feature of their development is their fontanelles, those soft spots on their skull. The posterior fontanelle closes by 3 months, while the anterior one takes longer, fusing between 9 and 18 months. Keep an eye on these during assessments. A sunken fontanelle can indicate dehydration, while a bulging one might signal increased pressure in the brain. Infants' immune systems also evolve during this time. They carry some immunity from their mothers and can gain antibodies through breastfeeding, which gives them added protection against illness. Lastly, let's touch on psychosocial changes. Infants rely on crying to signal distress and form bonds through secure attachment with caregivers. This stage is all about building trust. If their needs are consistently met, they develop a sense of security. But if not, they might experience anxious avoidant attachment or even separation anxiety as they grow older. This early stage is fascinating and so important to understand because it lays the groundwork for assessing and managing infant patients in the field. Let's keep going. Now let's talk about toddlers and preschoolers, covering ages 1 to 6 years. This stage is full of physical, social, and developmental milestones, so there's plenty to dig into. Toddlers are in the 1 to 3 year range, while preschoolers are ages 3 to 6. Physically, their cardiovascular systems begin to resemble an adult's, though key differences still exist. For preschoolers, normal vital signs typically include a pulse rate between 80 and 120 beats per minute, a respiratory rate of 15 to 30 breaths per minute, and a systolic blood pressure ranging from 80 to 100 millimeters of mercury. The trend you'll see is that as we get larger, our vitals tend to get slower, and our blood pressure is tied to our weight. Think hummingbirds versus elephants. These ranges provide a critical baseline for what's normal in this age group, which is essential for accurately assessing their condition in the field. Now let's talk about physical development. During this stage, their lung musculature is still underdeveloped, so they can't sustain deep or rapid breathing for very long. This is something to keep in mind if they're in distress. Weight gain starts to level off compared to infancy, and toddlers begin to lose the passive immunity they were born with. Neuromuscular growth also takes big strides, and most kids finish toilet training around 28 months. On the psychosocial side, this stage is all about building autonomy. Language skills take off. By about 36 months, most kids have basic language down. They also begin to interact with peers and start understanding cause and effect relationships around 18 to 24 months. Kids at this age are observant too. They recognize gender differences by watching role models. Playtime is more than fun, and it's how they learn and grow socially. This is a crucial stage for development, and understanding these changes helps us tailor our care. Let's keep going. All right, let's talk about how to approach school-age kids, those 6 to 12-year-olds, when you're treating them in the field. This stage of life is packed with growth, both physically and emotionally, and understanding what's going on with them can really improve how you connect and care for these patients. Physically, kids this age are growing steadily, about 4 pounds and 2.5 inches a year. Their muscles and bones are getting stronger, and their permanent teeth are starting to come in. Their vital signs are also in transition. You'll notice their pulse, respiratory rate, and blood pressure aren't quite like an adult's yet, but they're getting there. Knowing these ranges is key to recognizing what's normal for their age versus what's a red flag. Now, let's talk about how they think. At this age, their reasoning skills are developing fast. They're starting to understand cause and effect, but they still process information differently than adults. They go through 3 main stages of reasoning. Pre-conventional, where they're focused on avoiding punishment or earning rewards. Conventional, where they care about approval from others. And post-conventional, where they start relying on personal values and conscience. What does this mean for you? Keep things simple and logical when you explain what you're doing. If they know what to expect and why, you'll ease a lot of their anxiety. Emotionally, school-age kids are figuring out who they are, their self-concept, and how much they value themselves, which we call self-esteem. They're also super aware of their surroundings and how they're perceived by others. If you're treating them in a public setting, they might feel embarrassed or scared. Preserve their dignity by involving them in their care. Explain things directly to them, but also keep their caregiver in the loop. This makes them feel respected and in control, which is huge at this age. Also, remember, kids this age care about fairness and respect. If you're calm, patient, and treat them like an active participant in their care, they're more likely to trust you and cooperate. Give them choices when you can, even if it's small, like asking which arm they'd prefer for a blood pressure cuff. It goes a long way in building rapport. So, bottom line, know their physical and emotional milestones, talk to them on their level, and always aim to protect their privacy and dignity. When you take the time to understand where they're coming from, you're not just treating the injury or illness, you're also building a positive connection that helps them feel safe and supported in a scary situation. Now let's dive into the adolescent years, covering ages 12 to 18. This stage is a whirlwind of physical, emotional, and social changes as teenagers transition into young adulthood. It's also a time when we, as EMTs, have to understand how their unique challenges can shape how they respond to emergencies and to us. Let's start with the basics. During adolescence, vital signs begin to stabilize into adult ranges. A pulse rate typically falls between 60 and 100 beats per minute. Respirations range from 12 to 20 breaths per minute, and systolic blood pressure is usually between 90 and 110 millimeters of mercury. Adolescents experience rapid growth during a 2 to 3 year growth spurt, with girls typically finishing theirs by around 16 and boys continuing until 18. This period is also marked by the development of secondary sexual characteristics, including pubic and axillary hair, voice changes, menstruation, and acne, all driven by the maturing endocrine and reproductive systems. But adolescence isn't just about physical changes, it's a pivotal time for identity formation. Teens often struggle with family dynamics, pushing for independence while still craving support and guidance. They can be hyper-focused on their appearance and self-image, sometimes to an almost overwhelming degree. Peer pressure peaks during this time, especially between 14 and 16, often leading to risk behaviors like smoking, drug use, unprotected sex, and even antisocial tendencies. For some, this pressure manifests in eating disorders or depression, and unfortunately, suicide rates in this age group are higher than we'd like to admit. This brings me to a call I had with a teenager that really stuck with me. She had been in a serious car accident, one of those calls where my main focus was just keeping her alive. Her injuries were severe enough that my focus was on just stabilizing her and manage the lovely combination of head injury, blood loss, and so on. But to her, the biggest concern was whether she was going to be scarred, and what her friends and peers would think. Her focus wasn't on her injuries, her pain, or even her survival. It was on how she would look afterward. This wasn't vanity, it was her adolescent brain at work, prioritizing self-image as a life threat in itself. As EMTs, it's crucial to recognize this. Adolescents are often torn between wanting to be treated as adults and still needing the comfort and care of a child. They're forming their personal identity, trying to navigate peer pressure, and dealing with an overwhelming need to fit in, all while facing an evolving sense of independence. When treating patients in this age group, we need to approach them with sensitivity. Take the time to explain what's happening in terms they understand, reassure them when you can, and remember that their emotional concerns are just as real as their physical injuries. Adolescence is a complex stage, but by meeting teens where they are, emotionally and developmentally, we can provide the kind of care that not only treats the injury, but also addresses the person as a whole. That's how we truly make a difference. Now let's dive into early adulthood, covering ages 19 to 40. This stage is all about reaching your physical peak and setting the tone for the rest of your life, both physically and emotionally. Physically, early adulthood is when your body operates at its optimal level, especially between 19 and 25. Strength, reflexes, and overall efficiency are at their best during this time. However, this is also when lifelong habits, both good and bad, start to take root, and those habits can have a big impact on health later on. Vital signs in this stage are steady and align with adult norms. A pulse rate between 60 and 100 beats per minute, usually averaging around 70. A respiratory rate of 12 to 20 breaths per minute. And a systolic blood pressure in the range of 90 to 120 millimeters of mercury. On the psychosocial side, early adulthood is often about navigating major life milestones. This is when people focus on settling down by building careers, getting married, starting families, or figuring out their own path in life. It's a time of significant responsibility and decision-making, but it's also considered one of the most stable periods in life. While the pressures of work, relationships, and stress can be overwhelming, many people feel a growing sense of stability and control as they establish their identity and place in the world. For EMTs, understanding this stage is key to connecting with your early adult patients. When you respond to someone in this age group, keep in mind that they may be juggling a lot. Stress from work, worries about their family, or concerns about their long-term health. Showing empathy for the challenges they're facing can help you build trust and provide better care. Early adulthood isn't just about treating a strong, healthy body. It's about recognizing the emotional and social context these patients are living in. Now let's dive into the middle adult years, covering ages 41 to 60. This stage is all about balancing physical changes and psychosocial challenges while staying focused on life goals. Physically, middle adults maintain vital signs consistent with earlier adulthood. A pulse rate between 60 and 100 beats per minute, a respiratory rate of 12 to 20 breaths per minute, and a systolic blood pressure ranging from 90 to 140 millimeters of mercury. However, this is also when the body begins to show the effects of aging. Vision and hearing loss become more common. Conditions like diabetes, hypertension, and weight gain are more likely to emerge, and cancer risk increases significantly. For women, menopause typically occurs in the late 40s or early 50s, marking a major physiological transition. Despite these changes, maintaining a healthy diet and staying active can help reduce the effects of aging and support overall health. Psychosocially, middle adulthood is often a time of major life transitions. Many people are focused on achieving or reassessing their life goals. managing financial responsibilities, and balancing the unique challenges of this stage, such as children leaving home or caring for aging parents. These demands require a great deal of emotional and spiritual resilience, and many middle adults use this time to reflect on their lives and priorities. This stage can feel like a balancing act. However, it's also an opportunity for personal growth and renewal. For EMTs, understanding the health concerns and pressures of middle adulthood can help you connect with patients on a deeper level, offering not just physical care but emotional support as well. Let's keep moving forward. Finally, let's look at the older adult stage, which includes those aged 61 and up. This is a time of significant physical and psychosocial changes. These require careful consideration in patient care. Let's start with life expectancy. On average, people live to about 78 years. However, this can vary based on factors like birth year, genetics, and country of residence. Physically, the cardiovascular system undergoes natural decline with age. Atherosclerosis causes the vascular system to stiffen. As a result, the heart works harder to pump blood. Cardiac output decreases, blood cell production and blood volume drop as well, which can affect stamina and resilience. These changes mean older adults are more prone to fatigue, poor circulation, and slower recovery times after illness or injury. The respiratory system also faces notable changes. While the airway size increases, the alveolar surface area decreases. This reduces the efficiency of gas exchange. The chest becomes more rigid, lung elasticity diminishes, making breathing more labor-intensive. By age 75, vital capacity may be only half of what it was during young adulthood. Compounding these challenges, older adults are at higher risk for aspiration, airway obstructions, and lung infections. Weakened muscles and diminished cough and gag reflexes make clearing the airway more difficult. Understanding these physiological changes is essential for providing effective care to older adults. Their bodies have less resilience, and any decline in cardiovascular or respiratory function can quickly escalate into serious conditions. Let's continue exploring this stage to learn how to adapt your care for these patients. Now let's move on to the endocrine and digestive systems in older adults. The body produces less insulin with age. This slows metabolism and can lead to issues like elevated blood sugar levels. The digestive system also becomes less efficient. Reduced saliva production and slower intestinal movement make it harder to absorb nutrients. Decreased elasticity in the anal sphincter can result in incontinence, and gallstones become more common due to changes in bile composition. The nervous system undergoes significant changes as well. Brain shrinkage increases the subdural space, making older adults more vulnerable to brain injury and trauma situations. Neural networks slow down, which impacts reaction times and increases the risk of falls. However, it's important to note that while reaction times and physical processing slow, skill and knowledge typically remain intact. This distinction is crucial when treating older patients. The renal system also experiences a decline. Kidney filtration efficiency, kidney mass, and blood flow decrease, reducing the body's ability to clear waste and conserve fluids. This makes older adults more prone to dehydration and complicates how their bodies process medications, which can lead to a higher risk of toxicity. Understanding these changes is essential when caring for older patients. Their systems are less adaptable, and seemingly minor issues can escalate quickly. Tailoring your care to these specific challenges helps ensure better outcomes and safer treatment. Now let's discuss the psychosocial and sensory changes that come with aging. Despite physical challenges, many older adults retain high brain function until about 5 years before death. Most live at home. However, financial constraints and the need for assistance can create significant stress. This stage often brings feelings of isolation, depression, and the emotional challenge of confronting mortality. These psychosocial factors can have a big impact on an older adult's overall health and well-being. From a sensory perspective, hearing loss tends to be more common than vision loss, though both can affect quality of life. Many older adults rely on glasses or hearing aids to manage these changes. This can make communication more challenging, which may increase feelings of frustration or isolation. For EMTs, speaking clearly, at a slower pace, and in a well-lit environment can help ensure effective communication. We also need to consider the changes in skin function as we age. The skin loses elasticity and becomes thinner, reducing its ability to retain heat and regulate core temperature. Older adults are more dependent on their environment to stay warm, so if you feel comfortable on a scene, your elderly patient may actually be very cold. Keeping blankets or warming measures handy can make a big difference in their comfort and stability. Understanding these changes helps us approach older patients with empathy and adapt our care plans to meet their specific needs. Whether it's providing emotional support, ensuring clear communication, or managing their physical comfort, tailoring your care to the challenges of this stage can have a powerful impact. Let's wrap up with some final thoughts on this chapter while we recap what we've already covered. All right, team, Let's wrap up this chapter on lifespan and development, and with it, we're closing out Module 1 of your training. You've covered a lot of ground so far, and you're off to an excellent start in the program. Well done. In this chapter, we explored how the human body grows and changes throughout the lifespan. We talked about the unique physical and psychosocial challenges at each stage of life, and how these changes influence how we approach patient care. From newborns to older adults, understanding development is crucial for delivering the right care at the right time to the right patient. These skills form the foundation for effective assessment, clear communication, and targeted interventions in the field. One important final thought about working with elderly patients. Just as teenagers care more about their appearance and standing with others than they do about survival, older adults often prioritize their independence above all else. Many fear losing their autonomy more than their health or even their life. When you enter the home of an elderly patient, make sure your actions and words reflect the shared priority of helping them recover and return home, not being sent to a nursing home. Pay attention to the environment as well. Look for things like uncomfortable temperatures, tight or difficult entryways, and tripping hazards like bunched up rugs. If you can fix these issues while on scene, even in small ways, you'll not only lower their risk of getting hurt again, but also build trust and rapport by showing you're invested in their independence. Now, as we move into Module 2, we'll shift gears to focus on patient assessment and trauma. This next module will build on everything you've learned so far, diving deeper into the hands-on skills and critical thinking required to be an effective EMT. Before we dive in, make sure you're caught up on all your chapter tests and start preparing for the Module Y exam. This is your chance to solidify everything we've covered and set yourself up for success moving forward. Great work today and throughout this module. You're building a strong foundation. Keep up the momentum, and I'll see you in the next module.